were infected most likely 2 weeks or more in the past. If you have the IgM antibodies, you know that you were likely infected within the last 2 weeks. So I think it's an important piece of information for people to have, particularly people that aren't symptomatic. I mean, there's a lot of folks that are worried, maybe I have it, maybe I don't. If you don't have symptoms and you test negative, just understand you could always acquire it the next day. If you do an antibody test and you do have the presence of antibodies, that's really significant information. And so it's not as easy as the swab. It is a blood draw, so they're not going to be able to move as many people through. It just takes a little more time. But we do want to offer that to the general public. And I know some of the private companies are offering it very cheaply as well. With Florida, if you go through our sites, it's free of charge, but it's not that expensive if you wanted to do a private test as well. One problem that we've been seeing, if you look around the country, compare the number of tests that are being done on a daily basis today compared to what was happening in March. I think at the end of March, we were like 100,000 a day, maybe somewhere in that range as a country. Now we're 600, 650, we may even hit 700,000 tests in a day. The problem with that has been the lab turnaround is just getting backed up. You know, we have contracts with some of these labs, and the goal was 48 hours. They thought they could do 24. I never thought that would happen, but we were hoping about 48-hour turnaround. You're seeing turnaround time that's just taking a lot longer. The tests get backlogged. They're going every which way. And so we want to figure out, okay, how can we address that, knowing the capacity limits? And so what we're working on with the Department of Emergency Management, hopefully be able to announce it next week, is we're going to start having dedicated lanes for symptomatic people. And what we're going to do is we're going to contract with some of the companies who do the self-swab, send it in, and then get a quicker turnaround time. And we believe that we probably could get that inside of 72 hours, which would be very, very helpful. Part of the problem is when the tests are taking a long time to get turned around, if you're asymptomatic, well, what are you supposed to do? Stay home and wait if you're not sick? And then if you're symptomatic, obviously you need to know whether you have coronavirus or you have something else. So, but the symptomatic really, I think, is where we want to get the turnaround time as quickly as possible. So we're going to be doing that in a few of the counties, and we obviously would like to expand that, particularly if it's effective at doing a quick turnaround time. But for now, we're targeting Dade, Broward, and Orange counties for that, just because they have the highest volume right now. But hopefully we'll be able to expand it further as we go down the line. If you look at how this virus affects different age groups, it's abundantly clear. We've been saying it from the beginning. Those who are 65 and above are at elevated risk, and even once you get to the 70s, there's a difference between the 60s and the 70s. Likewise, 80s and 90s, and so it's really important that as a community that we protect the most vulnerable, and a lot of that is the long-term care facilities, which we've done a lot on and has been our top priority. But also, as you have folks who are 65 and plus in the community, it's important that one, if you're in that age group, that you're avoiding crowds and limiting contact outside your home as much as you can. If you're not in those groups, you need to be cognizant of the folks who are the most at risk for the coronavirus. Also, folks of really any age that have comorbidities, and some of them, obviously, if you have certain lung problems. But what we're seeing from folks in the hospitals pretty consistently, if you have somebody who's under 65 in that 55 to 60 range, the number one comorbidities they see over and over: obesity, diabetes, and hypertension. Obesity, diabetes, hypertension. That is very, very consistent up and down the state of Florida. And so, if you're in those groups, just be very cognizant about your close contact. And what we're telling folks is do your best to avoid the 3 C's, really close spaces, particularly, it's hot outside in Florida. People love that air condition. This virus is going to be much more transmittable in a stable climate where you're enclosed than it will be if you're outside in the hot sun and the heat and humidity and open air. Always avoid crowds as much as you can. The places that are really, really crowded, higher risk for transmission of the virus. And then the more close, sustained contact you have with folks, the higher the risk at transmitting the virus or you being infected. And if you look around the state, overwhelmingly, the number one venue for transmission is inside people's homes. And why is that? Because you're in an enclosed environment, you're in constant, close, sustained contact with people who are in your family, and that's something that we see over and over again friends and family. I will say some of the places that are hot spots in different parts of Florida, we tend to see a higher percentage of multi-generational living, so that you may have somebody who would be maybe in their 20s, you have a parent of a certain age and then maybe a grandparent. That ends up being a high-risk environment, particularly for some of those folks who are very, very vulnerable. So just understand kind of where the vectors are, what is more high risk, and try to minimize that, particularly when you're talking about our most vulnerable citizens. And I think folks understand the risks and understand what they need to do. So we want to encourage people to take those actions. I'm also happy to have Eugene Scalia here. I know he's going to talk about some of the stuff going on with the economy. We're really happy to see a place like Jacksport continue to function. And at the end of the day, we need our society to function. We need our society to continue to move forward. We can take steps to be able to minimize risk when you're talking about coronavirus, but we can't just leave society on the mat. And having places like Jacksport doing well is very, very important for opportunities, not only for our citizens here, but really throughout the country, because this is such an important engine. So I'm really glad to be here, and I'm glad that Gene has been kind enough to come down to the state of Florida, and I just want to thank him for all the support he's given us. So Gene.
Ron, thank you. It's very good to be here, and good to be here with you. I appreciate your spending time with me on this visit today. I've had the really pleasure to know the governor for a number of years before either one of us was in public office, and I was thrilled to know him then, even more thrilled to see him elected governor, and just so impressed, and I guess I can say proud of the job he's done as your governor. You're in very good hands, as you know. Dan, Andre, thank you for hosting me here. It's good to be in Jacksport. I had a visit earlier at Crowley Maritime, a great American maritime company. Met with the leadership there and with the employees there, and we'll be meeting with folks from Jacksport afterward, business and civic leaders, to talk about our economic rebound. And I guess we'll start with talking about what just an extraordinary economy that we were enjoying in this country until the virus struck us from China just a few months ago. As many of you know, we were at 3.5% unemployment in February. We put that jobs report out in early March. It tied a 50-year low. We had record low unemployment for African Americans, Hispanic Americans, Asian Americans. We hit a nearly 70-year low in unemployment for adult women. And as the president emphasized in his State of the Union address, we were experiencing what he called a blue-collar boom, because the benefits of this extraordinary economic condition and job market were felt especially by lower wage workers. We had hit the lowest unemployment recorded for Americans who don't have a high school degree. And wages were rising across the board, but were rising more quickly for lower wage workers, who saw about a 15% increase in wages in the 3 years since the president was elected. Then the virus struck. It's obviously presented some considerable challenges, but fortunately, the president, together with the Congress, moved very quickly in March to package a number of relief measures which have positioned us for a very strong economic rebound. One provision of the CARES Act was, of course, the Paycheck Protection Program to support small businesses, but even more importantly, from my perspective as Labor Secretary, to keep workers attached to their employer, so that when we were ready to reopen, the workers were there, the companies were still in business, and were ready to stand up and get going. And that is one of the reasons that we're doing well now. There were 400,000 companies in the state of Florida alone that received those Paycheck Protection Program loans in the amount of about $32 billion. Another very important thing the president did was, of course, the economic impact payments, $1,200 per taxpayer, $500 per dependent child, which provided needed money for American workers across the country. And then, of course, the $600 a week federal unemployment benefit. Back in the so-called Great Recession, 10, 12 years ago, our last economic downturn, the federal plus-up on unemployment was $25 a week. This time around, it was $600. Because of the extraordinary thing we were doing with our economy is we were shutting our economy down. American workers were being told that they couldn't earn a living in a number of states and locales. Well, as I said, this laid a groundwork for a strong recovery, and we are seeing some very, very strong early results. We, in the month of May, added, now we know, 2.7 million jobs to the U.S. economy. And in June, we at the Labor Department reported last week, we added another 4.8 million jobs, so that in just a 2-month period, we've put 7.5 million Americans back to work, and we know that we've put more back since then. The unemployment rate has dropped more than 2 points just from May to June. It's now at 11.1%, which is too high, and we need to continue to bring that down, continue to put people back to work, but we are so far ahead of where was projected. You know, back at the start of May, the expectation was that we were going to lose about 7.5 million jobs in May, but as I said, we added more than 2.5 million. Then we added nearly 5 in June, so that rather than being 7.5 million down, we're actually 7.5 million up. It's a 15 million job swing against what the expectations had been in May. So we are reopening, we're rebounding, and we're going to continue to work to maintain that momentum. And let me just mention a few priorities in that regard. First, of course, is safety. Governor's addressed that. He's been particularly strategic, analytical, and thoughtful about that from the start. I know he's been in close communication with the Vice President, with the members of the coronavirus task force on a virtually daily basis. We will continue to support the state of Florida as needed, and we'll continue that regular contact. And we'll also focus on safety in the workplace. That's part of our mandate at the Labor Department. It's one of the things that I was speaking to the folks at Crowley about. It's one of the things I expect that I'll be speaking to business and civic leaders later today. Let me talk briefly about schools. As I say, we're reopening. We're getting back to our ordinary life as best we can, while also contending with the virus. And to me, schools are an essential service. They're an essential service. We've had our factories in this country open throughout the pandemic. We've had our grocery stores open. We've now got Americans visiting their doctor and dentist, as we should. We've even got tattoo parlors open and hair salons. We're ready to open to our schools. We know how to safely open our workplaces. There are steps that can be taken that will be successful. And this is important to me as Labor Secretary because of how important having schools open and having children at school is to working men and women. And let me just comment briefly on 2 populations I think that's especially important for. First, lower income Americans have been hit particularly hard across the country by the measures taken to contend with the virus. They tend not to have jobs where telecommuting is as easy. Telecommuting is hard enough with children at home, and I know there are parents across the country that are getting up extra early to work before the kids are up, or staying up extra late to get the work done after the kids go to bed. So it's hard enough to telecommute when the kids aren't in school, but for many parents, that's not even an option, and those are lower income parents that we know have been hit harder by the virus, and that we think it's particularly important to help get back to work. And then second, working women. During the economy that we had before the virus came, we actually had a lower unemployment rate for women, adult women, than we did for adult men, which was extraordinary. Unfortunately, that's now flipped because women, as studies show, and I think a lot of people's experiences, tend to bear more of the responsibility in a lot of households for childcare. If we don't get our schools open, it's going to be that much harder for working adult women who are facing a higher unemployment rate to get back to work. So this is something the coronavirus task force we addressed yesterday, but we will continue to emphasize work with the states to help them find a way to open our schools. Finally, our focus at the Labor Department and on behalf of the President will, in a sense, be to pursue the same agenda economically that we were before the virus that led to the extraordinary economy we had. That was a jobs-focused, American worker-focused economy. It included, for example, an emphasis on apprenticeships. Today, the President at the White House will be announcing his Hispanic Prosperity Initiative to help that very important population enjoy all the riches and rewards of life in this country. And for our part of the Labor Department, that will include taking a look at the participation on the part of Hispanics in apprenticeship programs, which are one very important way to gain training that's essential for the workforce. Yesterday, the President welcomed to the White House President Obrador of Mexico to celebrate a really important date in American history, which is the USMCA going into effect last week. The USMCA replaced NAFTA, which really had devastating impacts, not just on our economy, but particularly on American workers, especially in manufacturing, agriculture, as we lost jobs and market share to our neighbors to the south and had reduced access to markets in Canada. The President pursued that change, ending NAFTA, renegotiating a fairer, more reciprocal trade deal from the day he became president, and achieved on a resounding bipartisan basis back in January something that everybody knew needed to be done, but nobody thought could be. And that was replacing NAFTA with a much better deal that we estimate will bring to the U.S. as many as 500,000 jobs or more in the years ahead. And those will be good paying jobs in manufacturing and other similar sectors. So again, it's a pleasure to be with you, to be visiting Jacksonville today, and be welcome to welcome your questions. And I'm sure the governor happy to take a few too.
Governor, question. This is Robert Bradfield with First Coast News. Two quick questions going off of what the Secretary was saying regarding schools. Your message of reassurance to parents across the state that the state will be doing the best that it can in terms of reopening, and maybe an update with the conversations that you've had with the Department of Education about how to do that. And then second, regarding the RNC, there were reports today that it may move outside. Didn't know if you've had, again, an update maybe with the host committee that you could talk about.
So on the schools, I'd say a couple things. One is, and Gene alluded to this, we spent months saying that there were certain things that were essential. And that included fast food restaurants. It included Walmart. It included Home Depot. If fast food and Walmart and Home Depot, and look, I do all that, so I'm not like looking down on it, but if all that is essential, then educating our kids is absolutely essential. And they have been put to the back of the line in some respects. Florida's done a better job with distance learning, I think, than any other state. But I'll tell you, there's a gap here. There's big gaps around the country, and we need to put them, give them the opportunity to go in person. I can say as a parent, I have a newborn, I have a 2-year-old, I have a 3-year-old. They're not old enough to go to school, so obviously they won't be in kindergarten or anything coming up. But I would not hesitate putting them in terms of the risk, because the risk, fortunately for kids, is extremely, extremely low. That data has been verified in virtually every single country, every single state. And we kind of knew that in March, although I think a lot of people, it's a new virus. I understand, look, my wife was very concerned. I know a lot of parents were just concerned. But now, I mean, that's very, very clear. And obviously, if you have a kid that's got a significant health issue, we absolutely need to make accommodations for that, and there are different things that you can do. The other reason, though, that people said back in March was, well, yeah, it does look like that kids are much lower risk, and that is true. CDC, if you look, under 18, substantially less likely to be hospitalized for coronavirus than for seasonal influenza, and that is just abundantly clear. Fatalities way higher with influenza for that age cohort. But there was the concern that, yes, okay, kids are low risk, but maybe they serve as vectors and end up spreading it further in the community. Well, that's been studied in a bunch of different countries, and it's been shown every single time that they don't serve as significant vectors for this like they do with influenza for whatever reason. And when they do get infected, it's usually an adult infecting the children. So I have no doubt we can do this safely. But I also told the secretary or the commissioner of education, I said, look, different parents have different calculations. If a parent wants to opt for virtual education, they should absolutely be able to do that. We shouldn't be forcing them to do any types of decisions. But I'm confident if you can do Home Depot, if you can do Walmart, if you can do these things, we absolutely can do the schools. I want our kids to be able to minimize this education gap that I think is developed. You talk to teachers about what happens over the summer and how there's a summer lag. Well, geez, now we're from mid-March all the way now, and in spite of good efforts with the online, it's just not the same. So I worry about that gap. I also worry about what it does to them in terms of just socializing. and being normal kids. Now, we do know that they do, probably the whole time, have been having friends and everything, but there's something to be said for being in school, seeing people you know, growing up like a normal kid. I'm also worried about missing out on activities. I mean, I don't want some football player to miss a season or not be able to play when they've been working their whole life to be able to do well, maybe go to college. It's just the costs are so enormously high, to have school closures. And so as bad as this has been to have a virus come from China like this, the one thing that I think has made it something that a lot of parents have been able to breathe a sigh of relief is it is less risky for young kids. And that, I don't know why. It wasn't true with the Spanish flu in 1918, hasn't been true with some of the other pathogens that have been unleashed, but we know the science, we know the data, and so we need to move forward for that. On the convention, my view was that outside was always something they were looking at. When they came to me, they said, look, all we want you to do is work with us. Safety is not negotiable. Like, it's going to be a safe environment. And I think you look at some place like the Daly's Pavilion, especially with Florida weather, I think you could do that in a way that would be very safe. So I think the outside would be a really good idea, but there's never been, we're going to do this, we're going to do that. And I know there's been speculation, but there's never been any plans submitted to me saying, hey, this is what we're going to do. So I think doing something at there, I think would be very good, and I think it would be a healthy environment. And here's the thing, you do the safety because it's the right thing to do, but you also, delegates need to be comfortable going into these places. And so I think that they will be, if you're able to do it, but there's a lot being worked on, and I'm not involved. It's more the city and the RNC than me, but just as somebody, who's going to make sure, hey, we want you to make sure people are safe, I can tell you, looking at something outdoors makes a lot of sense to me.
Governor,
Gene?
a quick question. On the New York situation, Governor Cuomo said that he was going to help Florida out, anything that we need. How did that situation come to be? How did New York come to be helping Florida? And do you want to take back any of the comments you made about New York in the last few months?
They're not helping us. We have no, I think that someone reached out to our office about ventilators. We got 6,000 ventilators just, sitting idle. So, we don't necessarily need it. Look, I think that if you look at how Florida approached certain things like long-term care facilities, I think our approach was superior. We prohibited sick nursing home residents from being discharged back into the facilities. A lot of the other states did the opposite, and I think the results, were better in Florida. It's still a tough issue. You got a lot going on, so I think that approach is superior. But yeah, no, we don't need ventilators. We don't need PPE. We are working with the federal government on some of the remdesivir, and then we're also helping at the state level with some of the hospital systems, just some of the staff support, just given the labor intensity. And it's not even the corona hospitalized, it's the incidental hospitalizations who end up testing positive that is really causing a lot of extra manpower issues. And so we're going to be helping out with that. And I think that folks are doing a really good job in the medical community. I know they've been working hard. We kind of I think this is more the natural peak for the Sun Belt. If you look what's going on in Georgia, Texas, Arizona, Southern California, South Florida had to deal with one, which was largely, I think, a result of people bringing it from the Northeast. But we're better prepared now. When you look at therapeutics, when you look at PPE, when you look at testing, we have 12 COVID-only nursing facilities where long-term care residents can be transferred if they test positive and don't need to be hospitalized, including Dolphin Point here in Jacksonville. So these are all tools that just weren't available in March that we have now, and I think that it'll make a big difference.
One more in the middle there.
Thank you. Brittany Muller with WJXT. Secretary, you touched on workplace safety. How do you enforce those guidelines? And also, Governor Ron DeSantis, with the convention coming up, you have more testing sites, surging cases. What do you think about the surging cases and testing with the RNC coming?
By the way, on the subject of schools, the American Academy of Pediatrics is so strong, their letter, on the value for students of in-person instruction and how actually the health risks to children of not being in school may well be greater than any risk which might exist in school. As the governor has said, The risks, fortunately, that this virus presents to children, for whatever reason, do seem to be less. But the American Academy of Pediatrics is concerned about the many different ways in which our children stand to lose out if we don't open our schools as we've opened now so many other workplaces. With respect to workplace safety, let me say first of all that I've been in the labor and employment field most of my career. I have never seen American businesses, American business managers, and American workers as focused on health and safety as they are right now. I think that the businesses that I speak with, those that I visit, have taken this extremely seriously. Often they are pioneering in what they're doing. And by the way, the American private sector has done a very good job finding ways to contend with the virus, reopen, get back to work. And I think part of what we're saying is let's see our schools set about it with the same vigor that the private sector has done. And they'll find a way to reopen and reopen safely. American business across the country has done a good job in so many places taking that obligation to their workers seriously. We have provided extensive guidance from the Department of Labor on how to reopen safely, stay open safely in a broad range of workplaces. I think we've got guidance on 19 different industries as well as for general industry. We've done a lot of that together with the CDC. And employers are using that guidance. Employees are consulting it. It's available to help them. That said, we're certainly also available to enforce the law. And in addition to the guidance that we've provided, we are conducting inspections, investigations as we receive complaints. And we have a number of different legal authorities at the Labor Department, which we will use if we have to in cases of employers that don't take their obligations seriously. There's always the risk there's going to be some company, some manager, we recognize that, who does not do what's needed to be done. We'll provide them the guidance they need to do the right thing, but we're there to receive complaints and take necessary action in those hopefully rare cases if they don't.
Governor, one final
Thank you,
question
Press.
for
Thank you.
Governor,
I'll answer about the cases. So I mean, here's a couple things that are going on with these cases, and I'll just tell people, we understand, much more about this virus. You should take precautions, but there's no need to be panicked. There's no need to be fearful. We understand the situations that make this thing more transmissible. We also understand the groups that are the most at risk for this. Here's a couple things going on. One is, you do have more transmission circulating around the community over the last month, or maybe 3 or 3.5 weeks, than we did at the end of April, all through May, beginning of June. I mean, in Duval County, you'd have like 3% would test positive. Heck, 2% is probably false positives when you do this. So it was very low prevalence all through May, all through the beginning of June, and then here, like other parts of Florida and quite frankly the whole Sun Belt, you started to see more people test positive as a percentage. So that's something that's obviously a concern. Part of it, though, we are testing a lot more. There's no doubt about it. If the country was testing this much in March, you would have seen huge numbers in March and April across the country. We would have seen much bigger numbers in Florida than we saw because we were testing 6,000 to 7,000 people a day. So you do have way more testing. You also have criteria, which is basically community test. If you want to test, come get it. Well, many of the people who are testing positive are asymptomatic or very minimally symptomatic. They would not have qualified for a test in March, much less have tested positive. And so when you're looking at these things, I think we've had since the beginning of June, over 100,000 positive tests have been under the age of 45. Now, if you look at the fatality rate in that group, I mean, it is incredibly low and probably basically zero if you take out some significant comorbidities. And so a case does not necessarily mean someone's in the hospital or anything like that. It means they tested positive. And so I think folks should just view it in the proper context and perspective. At the same time, we would like to see positivity decline. I mean, if we have 1,000 people test, we'd rather have 5% test positive than 10, 15. In some places, Miami-Dade is in the 20s. When they started, they were in the 20s. We got them down to the single digits, about I think 7, 8% they would test, and then now it's going back up, and you're seeing that in different parts of the states. So that's a concern. I think that community transmission has been driven by that under 45 cohort. A lot of people in their 20s in particular, the number one age for positive tests in Florida throughout the whole pandemic right now is age 21. And so that's probably a sense of, you know, how that is really spread in those age cohorts. The problem with it is, although there may not be huge clinical consequences in that cohort is not segmented from dealing with people who may be older with comorbidities, maybe people who are 70, 80 years old, particularly in family situations. And so, again, I think the message is, you know, we need to protect the vulnerable. You know, if you're in those vulnerable age groups or have the comorbidities, you know, be very careful about the types of close contact you have. Avoid crowds at all costs, because those are going to be the situations, you know, where you're going to be most at risk. And so, you know, we're going to continue to do a lot of testing, but we also understand that, you know, we're testing a lot of folks. A lot of the folks who are testing positive, fortunately, have not developed significant symptoms, or in many cases, any symptoms. So if we can protect the elderly, continue to protect the long-term care facilities, you know, I think we're going to be able to get through this in as good a way as we can. But that is really where most of the consequences are falling with this thing. And so we've just got to be extra vigilant in helping support our senior citizens and our long-term care facilities. Thank you.
Thanks, guys. Thanks,
COVID-19
guys.
specific ICU
Got a
data be
very
released?
tight time frame.
Governor, will the COVID-19 specific ICU data be released?
Yes, sir.
Okay.
Yes, sir. Thank you, guys.